our talk on our fat-soluble vitamins, we are going to have a surprise that was completely unexpected that arrived at my office, and I brought it to share with you guys. So stick around. I couldn't believe this cake. It was totally unexpected. So we'll be right back. One more minute, and we'll open that box.
Hey everybody, Dr. Kamika Baylor here, and you're tuned into Dr. BARI ACT RIGHT, where you know you're going to get some act right. And today we're going to talk to you a little bit about vitamins today. So I hope you're ready to dive into that. We're going to focus on some vitamins today, but a specific group of vitamins that are vital for our health and could be potentially dangerous if we don't take them the correct way. And those are the fat-soluble vitamins. And we're going to talk about them, vitamins A, D, E, and K. They can be harmful if you don't take them the right way. And if you take too much, you can have an overdose of vitamins, and that is possible with fat-soluble vitamins. And these vitamins are so important that if you are deficient in them, you will have harm as well. So it's on both spectrums, too little or too much. You need a right amount of being absorbed so that you can function properly. Robust immune system and vibrant for your skin. We're going to talk about vitamin A. It's a crucial vitamin for healthy vision, for a robust immune system, and for healthy skin. But excess vitamin A intake can lead to toxicity, causing nausea, dizziness, and even hair loss. So you don't want to take vitamin A excessively. Hey gang, welcome back. So, like I said, we're going to dive into vitamins today, and it's a specific group of vitamins we're going to talk about, and that's vitamins A, D, E, and K. Those are our fat-soluble vitamins, and these vitamins are crucial for our health, but can also be harmful if taken inappropriately. So, it's very important that you not have too much fat-soluble vitamins or too little. You need to stay within a range that your body is absorbing the right amount, because too much can lead to toxicity and too little will lead to deficiency. So first we're going to talk about vitamin A. It's crucial for our vision. You really need vitamin A to see, okay? That's serious. And then also it can help with your skin and make your skin a little more vibrant. But if you take too much, it can cause toxicity, which can be shown as nausea, vomiting, dizziness, and you can even have hair loss. So take your multivitamin, but don't supplement vitamin A unless the doctor specifically says you need more vitamin A. And then moving on to vitamin D. Same thing. We're going to get some vitamin D from our multivitamin that we'll take every day. And then we'll get vitamin D also from the sun when we go outside. So it's very important that you get access to the sun, not too much. Be sure to wear your sunscreen and reapply if needed. But going out to the sun will help you get some vitamin D absorbed into your body. And so also you can get vitamin D through supplementation. And it's in your vitamin already. You're going to get that in your multivitamin. But some people still are deficient in vitamin D when the doctor does blood tests. So you'll supplement. But you need enough vitamin D to help with the deficiency. Any more than that will cause toxicity, and you can have too much vitamin D, and that could lead to hypercalcemia, which can be harmful to your body. So always take the recommended dose of vitamin D unless your doctor says otherwise, if you're deficient and he wants you to supplement more vitamin D. Typically, vitamin D, taking 400 international units a day is usually sufficient. But if you are truly deficient in vitamin D, you can have up to 50,000 units of vitamin D that you could take once a week. So other than the regular dose of vitamin D, you should not over or take vitamin D excessively because it can be harmful. So now we're going to move on to vitamin A. And everybody loves vitamin E. We're going to move on to vitamin E. Everybody loves vitamin E. We get it in all our skincare products, hair care products. It's very good for our skin and hair. It's a powerful antioxidant as well, and it's also good for our immune system. It helps support our immune system. However, too much vitamin E can lead to bleeding. So it can thin your blood. You want to be taking excessive amounts of vitamin E because it can cause your blood to be so thin that if you have a serious event, you won't be able to have clotting to stop the bleeding. So you don't want to take excessive vitamin D, especially if you're on blood thinners or you take your daily dose of aspirin. Your blood is being thinned already. Vitamin E will increase that blood thinning, and you can lead to more bleeding if you have a cut, or more bruising if you bump your leg or your arm and you get a bruise. It'll be easier for you to bruise. So don't overdo on that vitamin E. And when I mean don't overdo on vitamin E, I'm really talking about taking it by mouth. Topically, it doesn't have that same effect, but when you take additional vitamin E by mouth, you need to be careful. So last, we're going to talk about vitamin K. And vitamin K is good for our blood and for our bone health. It helps with clotting factors in our blood. So, but if you are on blood thinner, just like with vitamin E, you shouldn't take vitamin K because it can interfere with the medication that is thinning your blood. So if you are like maybe a cardiac patient or somebody who needs something to constantly thin their blood, this can counteract that medication and cause you to clot more, which could lead to another cardiac event. So be careful when you take vitamin K. I really don't see too many people in the pharmacy coming to ask for vitamin K, but it is in your multivitamin, so know that. So you don't need to take additional vitamin K unless your doctor tells you. And if you are on blood thinners or you're a cardiac patient, let your doctor know that you want to take vitamin K, and you'll see if it's okay. Or take your medications to your local pharmacy and ask your pharmacist if it will be okay, or if there's a drug interaction between your medication and vitamin K. And that's true of most supplements, I should say. You should be cautious before you just go start taking supplements if you are on a medication that you need to take on a daily basis or continuously, because they could lead to drug interactions and cause the medication to be increased, decreased, or cause certain adverse effects. And also, you may be needing to stop those supplements before they can even start a medication. Or if you're going to have a procedure, they may say stop these vitamins or supplements. So always take them in. We're talking about fat-soluble vitamins today, but always, if you're unsure and you want to know, let your pharmacist know I take these supplements as well as these medications so they can do a drug interaction check for you, and also let your doctor know. He will let you know if it's even necessary for you to be taking those supplements and spending the money when you don't really have to. Okay, so that is what we're talking about with the vitamins. I'm glad you were able to stick around for this long. uh those vitamins A, D, E, and K are required. You need those to function normally, but you don't need to supplement them unless the doctor says. You don't need to excessively supplement them at all. So the normal amounts that you get in your multivitamin that you take once a day should suffice. But unless you're deficient in these vitamins, you do not need to go supplement anymore. Okay? And also be sure to talk to your doctor about starting any supplement or vitamin before you start taking it. Make sure it doesn't interact with either current drug regimen or your condition that you may have. That is all we're going to say about the vitamins. And now I'm going to tell you about what I was so surprised to see that came to me today. Bariatric Advantage. And it's like their little, it's their, fix this a little bit. It's their supplement, uh, it's their supplement kit. It's a sampler. It has a different kinds of their bariatric vitamins in the pack. So we'll look at those right now. It came in a nice little box, nicely decorated, and I got a box full as a gift to my office to give out to my patients if they wanted to try out Bariatric Advantage. This is not sponsored. I just thought this was really cute, and I like that they were able to send this out to the office just to give everybody a little sample of what they're offering with Bariatric Advantage. In the sampler, they give you, it's called the best sellers vitamin sample kit from Bariatric Advantage. And this is the leading company in bariatric vitamins, and these vitamins are specific for people who've had weight loss surgery because they're the amounts that we traditionally need, and they're formulated to absorb better if you've had bariatric surgery, and they're have enough of what is traditionally necessary after you have bariatric surgery, and they have a whole line. You can shop online as well. They give you a little pointer, and you can subscribe to their newsletter, and they'll send out things for you. You can enroll and order your vitamins through them, and you can get a subscription with them too, and they'll send them out automatically. They have a lot of information on their website about vitamins and about how and what vitamins you need when you have bariatric surgery. These are the exact vitamins I use when I'm taking bariatric specific vitamins. But these in this pack, they give you this little pamphlet, which is a great little sampler information guide about supplements. Very informative. Has a little deficiency chart in there. You probably can see. But yeah, this is nice. This is a nice keep around, put on the refrigerator type pamphlet. And then they give you a coupon and $5 off, just as a thank you when you order from Bariatric Advantage in this sampler. And let's get to the goodies. So they sent, the sampler has chewable vitamins. This is their Ultra, can you see that? Ultra Solo in citrus flavor, and it's a multivitamin that you take once a day, and it has iron in it as well. And then they sent the chewable Advanced Multi EA, and this one is in the flavor mixed fruit. Yeah, so this is just a multivitamin without iron. And then they send some calcium chews. And the good thing about there is that even though they're chews and chewable vitamins, they don't have too much sugar. They're sugar free, so that you won't get dumping syndrome, or you be over calories. You won't be getting more calories from your vitamins. They sent a Floral Advantage probiotic, little probiotic. You know how we need those for our gut flora, especially after we have bariatric surgery. And it's in a grape flavor, and you just take this once a day, and it's not a chewable, so you swallow this one. Okay, and then they gave us another calcium chew, and it's the 500 milligram calcium again, and this is also sugar free, and they gave us a strawberry flavor. And one more ultra solo with iron, and this is a capsule. You swallow this, you don't chew it. This solo one is chewable. This other one is not. This one you swallow, and then they have the chewable version. You swallow whole. Make sure you always take your vitamins with a full glass of water, and try to stay as consistent as possible. I would even say set an alarm if you think you might forget, or have them in a place where you know you'll be able to remember to take them every day. You can also add it to your calendar too, like your work calendar or your business calendar, where you have it on your schedule, because sometimes a lot of us work better by schedule, right? So I would add it to my schedule as well, like 7:15. The task to complete is taking my vitamins with a full glass of water. Okay, so whether you're going to take your calcium, your iron, or your multivitamin as directed by your doctor, healthcare provider, try to be consistent as possible. And then you've been consistent, go get your lab test done regularly. So that's what we got from Bariatric Advantage. You can visit their website. It's bariatricadvantage.com, or you can call them at the 1-800 number, 800-898-6888. And you can order if you like. This is not sponsored. This is just some vitamins they sent over. I thought this was really cool that they sent this in the mail for me to give out to my patients. And I'm going to keep this pack for me. I'm going to keep the whole pack for me this time. So if you have any more questions about fat-soluble vitamins, or you want to know any more about Bariatric Advantage vitamins, you have a question for me about Bariatric Advantage vitamins, you can leave it in a comment or get in touch with me on my website, www.drkamikabaylor.com. And if that is nothing else left, I'd like to wish you a good day, and you get out there and act right, all right? See you next time.